In a practice, even the right decisions can lead to a courtroom. Case Closed examines real malpractice claims, the clinical choices behind them, and the lessons that can help protect your practice. Today's case follows a routine surgical correction that uncovered the unexpected and led to 7 years of litigation. The patient was a 54-year-old female with left hallux valgus deformity, moderate degenerative changes at the first MPJ, and an increased intermetatarsal angle. She presented to the insured with complaints of right heel pain and painful left great toe joint. A plantar fasciitis injection was provided for the right foot. An X-ray revealed hallux valgus deformity, with moderate degenerative changes and an increased first IM angle. Over the next 3 months, the patient underwent 6 MLS laser treatments. She continued to complain, so the insured performed a left first metatarsal osteotomy and chilectomy. During surgery, the podiatrist discovered a large bone cyst. After removing it, the bone cyst defect collapsed. Bone cement, bone graft, and plates with screws were not available at the surgery center. The only option was placing an implant. This resulted in bone loss beyond what was anticipated, and a 16mm implant being placed, with shortening occurring. Postoperatively, the insured discussed the cyst with the patient and proposed surgical correction with a bone graft for lengthening, along with distraction using an external fixator. The second procedure would require prolonged, non-weight-bearing recovery, inability to wear high-heeled shoes, and lifelong pain and discomfort. The patient declined the second surgery and sought a second opinion. The second physician offered only conservative treatment. The patient never returned to the insured. Allegations included failing to select proper treatment, negligently removing too much bone during surgery, failing to obtain informed consent to harvest bone, failing to properly seat the hemi implant, and proceeding with surgery beyond the skill and experience of the insured. The case went to jury trial 7 years after care was provided. Defense counsel attacked the patient's sole expert, and strong expert support backed the insured. After a 9-day trial and just 90 minutes of jury deliberation, a defense verdict was returned in favor of the insured. So what can we learn from this case? First, unexpected situations can occur, and how you handle them is critical. The cystic first metatarsal head was unknown prior to surgery. The surgeon made the right decision during surgery, given the options available, and discussed complications with the patient. Second, claims can be brought against you years later. Allegations can surface well after care is provided. This is why thorough documentation matters. Your memory of events may not be reliable. Even with an appropriate diagnosis and procedure, things can still go wrong. This patient was appropriately diagnosed, and the procedure was appropriate. Even when things go right, you can still find yourself in the middle of a lawsuit. This case underscores a difficult reality of podiatric practice. Sound clinical judgment, appropriate treatment, and a successful defense verdict still required 7 years of litigation. Preparation, documentation, and clear patient communication remain your strongest protection. To learn more and download this case, visit our website and start safeguarding your career today.